One. Welcome, everybody. I have a special guest with me, Dr. Sarvar Pathan. He's actually an individual that works on my shoulder and neck issues as well. And we have several clients that we see together that we met or we sent to each other. And now we're working together on both ends of the equation to make sure that they're able to maintain their workouts as well as heal their injuries. So I'm allow Dr. Pathan to step in and introduce himself a little bit more. The floor is yours.
Hey, everybody. Awesome. Thank you so much for having me, Monte. It's such a pleasure and it's an honor. And I'm very grateful to be able to serve all our clients, including you, and help with the discomfort and keeping everybody active and healthy. So I am Dr. Sarvar Pathan. I am the CEO and founder of Personalized Physical Therapy and Wellness. It's a very much of a concierge medicine style physical therapy practice here in town of Winston-Salem, where we help active adults and athletes, help them stay active, return to activities they enjoy, live free from pain medications, and avoid surgeries. And that's the honor that we have to be able to serve the community. So we're very grateful.
Oh, good. Also, do you have other locations besides in Winston, in the surrounding area?
So we also have another satellite location in Boone, where we see clients about 3 days a month. So we basically schedule everybody out and we drive and we have the patients scheduled. Dr. TJ, he's one of our practitioners who is a golf certified and back pain specialist as well, musculoskeletal. He also does dry needling. He is actually going tomorrow to Boone. I go there once a month. And our practice is also mobile. So about 30% of our patients are mobile, which means that we can see our patients at their home, at their gym location, whatever they prefer, while we also serve the in-office brick and mortar style of practice.
Well, that's great. Also, before we get into the specific questions that I wanted to ask you, because I wanted to cover some things with the shoulder and neck region, because as we spoke before we came on air, the shoulder is one of the easier things or most common things to get injured, from my understanding, as well as the back as well. But in my own experience with the shoulder and how it has set me back, I'm really interested in first figuring out what are some basic things we can do in order to minimize the risk of damaging the shoulders, especially those who are engaged in workouts. I see a lot of clients, or I see a lot of individuals who may not be my clients, and a lot of individuals in my group classes, that they don't prioritize the technique, and I see them setting themselves up for injury down the road, as I found myself injured. So what are a few things that an individual should prioritize when it comes to protecting the shoulder if they're going to start training, or even if they're not training, just simple things that they can do in order to give themselves the best chance not to injure the shoulder?
Yeah, a great question. So my best 3 assessment methods to prevent any injury or to find if there is an injury possible is the 3-step method called the mobility check, the stability check, and then the strength check. And so 3-step method, mobility check, is where you first look for how much flexibility and range of motion do you have in your shoulders. Shoulders have one of the most freedom of motion that any joint can possess. It has 180 degrees of motion. So if I were to back up, it could go up straight in the vertical plane, and then it can go out to the side and up in the horizontal plane, and then it can rotate 90 degrees back that way or beyond, and 90 degrees down that way. So that's 3 planes of motion, significant ranges 180 degrees. Now, with the benefit of having all this flexibility, we also have the detriment of stability. So it is a ball and socket type of joint. So if this was your humerus, which is this bone, humerus, and it attaches to your scapula like this, so it's a ball and socket joint. So it offers all this flexibility and range of motion of 180 degrees and the internal and external rotation, but it doesn't have so much of the stability. It doesn't have the full cupping effect. It only has, you can say, about 30% of contact joint surface. 70% is free, open for movement. With that, the stability gets impacted. Now, there are specialized muscle groups called the rotator cuff muscles. There are 4 of them, and those muscles take the most brunt of stabilizing this humeral head to sit inside this small cup all the time when you're moving the arm, rotating, taking it over head, inwards, outwards. So that's where the second step comes in, is once you have the full freedom of motion, then you have to make sure that you have the control and, like you mentioned, the form, the technique of the motions. Shoulder is also notorious to be a very good compensator. So, of course, something that you might have noticed with our training or with your clients is that if they're trying to raise the arms up and if the weight is heavy, what are they going to do? They're going to try to shrug it up there. Yeah. And that affects their the injury. That's when the injuries happen. We have a little space up here called the subacromial space, and that subacromial space causes the tendons to butt and cause tendonitis and scrubs on it, and cause tendonitis when we start to do these compensatory motions and the scapula rotates faster than it does. And then the third thing is strength. If you just don't have the same level of strength in muscle groups, sometimes you lose muscle strength in some muscle groups like your mid back, and you end up having tightness in the front chest. You know, this day and age, we're on the computer, you know, desktops, forward head position, rounded shoulders, all of that causes tightness in the pecs and weakness in your mid-scapular muscles called the rhomboids, the trapezius. So those causes imbalance in the shoulders, then come forward and cause more tendonitis.
Oh, okay. That's what's going on. Yeah, like you were saying with the range of motion and those things, remember when we first started with me, my range of motion due to the pain and the injury was very limited. But now when we do the range of motion, it's a lot better, and it's gradually getting better each time I come to see you. So I can state for my own personal experience, the work that you did and are doing with me is working. It is a slow process, and that's one of the reasons I wanted to tackle the shoulders, because when people injure the shoulders, from what I've seen, and not from afar, and then with myself, that it can be a tedious, long recovery process, especially if they're not doing the personal or the physical therapy type of stuff that helps to re-strengthen that muscle group correctly. And you would say, how long would you say for a generalized person who say they don't have a rotator cuff tear or anything like that, but they have some tears around those 4 muscle groups? What would be like the recovery process, length time for, in general, for individuals who may be dealing with a tear or something like that, not necessarily the complete rotator cuff replacement type thing?
Right. So being 30% stable and 70% mobile, there are so many soft tissue structures that are kind of holding the shoulder in place. So, you know, for conditions as simple as tendonitis, like the biceps tendonitis or supraspinatus tendonitis or impingement, typically 6 to 8 weeks is like the max amount. You usually recover very quickly. from tendinitis. Depending on the extent, obviously it varies, but pretty much 6 weeks is long enough for that. Then there's next level is like actual ligament tears or labrum tears in your shoulder. That takes much longer. It also has different grades, grade 1 to grade 3, and grade 3 is when it's completely severe. But if it is grade 1, it's like 25% torn, 50% torn, and then 100% torn. So those vary, of course. And then the major one that we typically see most of the time is a lot of these postural conditions, that resonate into the shoulder through tingling and numbness, called the radiculopathy, but it's actually coming from the neck. And there's a condition called the upper cross syndrome. So it's a lot of the neck issue that is causing the shoulders, and that's, if diagnosed properly, it is quickly reversible. Once you get the neck under control, once you get the the radiculopathy under control, it's fairly recover in like 2 months, 2.5 months would be a good recovery phase, going back to training and whatnot.
Yeah. Was that similar to what I was experiencing in my neck with the burning that was shooting down?
Yeah, the radiculopathy. Yeah.
Yeah. Okay.
Yeah,
and
the burning.
I no
the
longer
nerves.
feel that anymore. But that's so I can relate to all that pain that was causing, and then I thought it was all shoulder, and when I came to you made it clear that it was coming from the neck.
Yeah, and
so,
you are one who have good consciousness about your posture, so you've sort of been able to make stop it from getting it to get worse. But the chronicity, like the length of time one has this problem, varies, and so the recovery also varies. The longer it has been, the body then adjusts and acclimatizes, and then other joint starts to accommodate to compensate for what you need to do day-to-day activities. So that's why we do our personalized assessments, to make sure that what stage are you at and what time will it require, and then we draw out a personalized perfect patient plan, and we distribute that into mobility, stability, and strength, and then preventing injuries. So we kind of break it down into 3 different phases and kind of get you back into your normal activities that you want to do, like in your case, going back to training again. So
yeah, definitely. So we'll wrap this up shortly, Sarvar, and let's focus back in on those 3 things. Just tie a bow on those 3 things that you just mentioned as well. The 3 phases that you look at in order to determine how you go about working with the individual, with the strength, the mobility, and I forget the 3rd one, but I know you know it.
The stability. Yeah. So just important things to keep in mind. If you experience any kind of tightness in your pecs, in your neck, or in your mid back, it's likely that you have shoulder range of motion limitation. And if you are not being mindful of addressing the flexibility, which is the first phase, the mobility, flexibility, interchangeable, it's the first phase, then you're going to affect the stability of the shoulders, which means that you're going to start to do shrugs, or you're going to try to hold the shoulders forward too much, or you're going to start to compensate by, if you're doing overhead presses, you're going to do it with your arms being more in front and trying to load it versus being out to the side. And that's when the stability gets impacted. So you first mobility, second is stability. For stability, you have to make sure that your form is correct. Follow what Monte watches your form and describes how it looks and it feels. And then the 3rd one is the strength phase. And strength is basically we have these dominance, like there's difference between the pec strength versus the mid pec strength, and the anterior deltoid versus the posterior deltoid, upper trapezius versus the lower trapezius, which is down there. So get a strength assessment, make sure that if it is too tight on one, then needs to be released. If it is weak on the other, then that needs to be toned. So again, your trainer or your therapist can discuss further on that.
Yeah. Okay. So that's great advice. So we'll wrap this up right here, and we'll get back to some more things next time we meet up, and we'll talk more about the lower back, which is one of the ones that you said is a lot prevalent. So we'll deal with that on the next episode that we come together with. And again, hopefully you guys have gotten a lot from this video. Remember, strength, mobility, and stability, right? When we're dealing with those shoulders, like, want to make sure that you are listening to that. And if you're having any issues, I highly recommend that you go and see Dr. Sarvar, or if you can't, or not in Winston and you can't come see Dr. Sarvar, then you have to go and see somebody in order to not allow that to get worse. So if you're in the Winston area, definitely I ask you guys to reach out. And if you want to leave any of the information as far as how they can contact you in your office, you can send it to me and I can put it in a link, and or you can share some of it right now as well. But either way, I'll be able to put it in a link.
Awesome. Yeah, I suggest that you go to our website. Website is www.pptaw.com, which is basically the acronym of the business name, Personalized Physical Therapy and Wellness. So pptaw.com, and you can sign up for a free discovery call, which is a 15 to 20 minute free discovery call about your condition, and we can educate you for what next steps to take. And we can add the phone and email on the show notes. Yeah,
definitely would do that. And again, I would definitely get that onto the video in the description as well. And when I tee it up for a little bit of editing, I'll probably be able to put it on right when you're saying it as well. All right. So I'm gonna go ahead and end this. I'm gonna keep you on for 1 second. All right. I'm gonna end it for everybody else. Look forward to seeing everybody else at the next one. Have a beautiful day. Sending you peace and love. Peace. All right.